Time now for this week's Health Matters. Paul Critz with you, along with physician assistant Lynn Szabo. And today we're getting into the tech. We're going to nerd out a little bit. And I have a very key question. What is the topic of today's Health Matters, Lynn?
So what is an EKG, otherwise known as an electrocardiogram?
My first question, the diving board into the pool of knowledge for me, why is it K?
Yeah, I don't know, because it's also called ECG in Europe.
Okay, and I'm just...
Because that's the way they taught us. Somebody apparently couldn't spell.
My wife, Lisa, said she thought it was because maybe there was another test that might be confusing, the EEC or something like that. If you have like
ECG, electrocardiogram, then there's one about muscles.
Okay.
Yeah,
okay.
Which sounds similar. So yes, that might be it.
Okay.
I'll go with it, sure. But it's kind of like nails on a chalkboard to call it an ECG, and we hardly ever hear that unless there's a doctor who got his medical training from out of the United States.
Wow, okay.
It's kind of interesting. Huh. But it's an important thing. It's a lovely thing. It's the electrophysiology of the heart and what you can learn by scratches on a piece of paper, which is actually popularized. I think there's I've seen tattoos that are kind of stylized EKGs and, on the side of ambulances and all kinds of advertising that has it.
So that stereotypical like sinus sine wave, the dump dump, that's from an EKG.
That's from an EKG.
Wow. Okay.
So what this is a recording of the heart's electrical activity, and usually in repeated cycles and from different vantage points.
What's repeated cycles mean?
So looking at more than one heartbeat.
You mean in time?
Yeah.
Okay, yeah.
Yeah,
okay.
There's a time vector. And you can also look at it. So each of the leads, it's usually a 12 lead. So when you have the little sticky things on you, it's each of those is getting information and looking at the heart from a different angle.
Sure, okay.
In the body. And then you can kind of synthesize information like a totality of information.
So the leads that are put on you, little sticky things, right? And they're called leads. Is that what they're called?
Yeah.
Okay. So they're not looking at what's happening right there at the point where they're applied. They're not looking at your circulation. They're actually looking at the heart.
They're looking at the electrical activity and how it moves from the heart from that vantage point over time.
Okay, gotcha. All right. So, they're measuring your body's resistance then, in a sense, right? They're measuring the electrical current that is happening.
Yeah, it can be. That's the way to look at it in terms of pathology. But they're also looking at normal pathways too. So not necessarily resistance. It's more like pathways.
How precise does the placement of the leads need to be?
It really needs to be precise, and usually it's something that medical assistants try not to do. There's usually one person who's kind of like an ace at it, and they count down, and they go from like mid-clavicular lines, so they measure in the middle of your clavicle, and they go down a certain number of ribs, and and that's not all. There's all kinds of anatomical features that they kind of measure it off of.
Okay.
Yeah, and you might notice that you have some that are on your arms and legs too. So the electrical activity of the heart, and it starts at the sinoatrial node. Okay. So it kind of arises from that. It spreads through the atrium, which are the two top chambers of the heart, passes into the ventricle, or the two bottom chambers of the heart, via what's called the atrioventricular node. That kind of makes sense, like a little doorway between the top chambers and the bottom chambers. And this is my favorite. It travels through nerve pathways called the bundle of His. And then into the Purkinje fibers.
The bundle of His.
Yeah, I put that in because it's, like good cocktail trivia, and because it kind of highlights in medicine how things are named. So those are kind of two random names. And can you imagine being totally overworked medical student and trying to put that in your mind in a coherent way when it doesn't really relate to anything?
Well, yeah, I don't know. My angle on that is that it's such a standalone, the bundle of His. How can you not forget? How can you not remember that?
Because almost every there are thousands of names in medicine that are randomly named after. It was probably Dr. Hiss and Dr. Purkinje.
Okay, right.
Or they might not even have been physicians. They might have been just anatomists who described it for the first time.
Right.
So it was super random, but
So this stands out just in the context of your notes.
Right,
this stands out
but
to
not
me.
necessarily in the context of all medical knowledge.
Right.
So old dead white doctors have a lot of stuff named after them.
Okay.
So anyway, kind of interesting. So it travels through these nerve pathways, and then it's what we do with the leads is we pick up the electrical pathways or the electrical energy, and it's printed as it moves through a heartbeat. And you can measure one heartbeat, you could measure a series of heartbeats from a particular location, or you could look at all 12 locations, and you could look at heartbeats up to weeks. Actually, like somebody in intensive care unit probably might have this going for like weeks or months. So kind of a cool little thing. And there's a lot of things you could, so let me back up a little bit. The reason I thought this was an interesting topic, because we talk a lot about how Del Nordians have to advocate for themselves a lot. I don't think EKGs are done as often. And I'm going to go into why they bring useful information to us and how they might answer somebody's particular question about their health. And I think average Del Norte person should understand them a little bit so that they can intelligently ask for what they need.
So you're saying you don't think that EKGs are done as often as what? As
Right.
often as they can be or should be?
Well, they're a hassle. So and right now they're all computerized, and it's difficult for people to get the programs to work and stuff like that.
Really?
Yeah, it takes a long time. It takes probably about a half an hour. That's a long time if you only have 7.5 minutes.
Yeah.
So I think it doesn't happen as often as it should.
I'm interested in that sort of technological angle. Do we get into that here later on?
No, not really.
Okay, so what is the... So it's no longer, I remember things like the big thing that gets rolled in and the paper comes spilling out.
Right, it almost never works. And then they got to get the EKG whisperer to come in and kind of like,
kick it. Or
whack it in the right place. And, or they run out of paper, or, the leads won't stay on. There's all kinds of little technical issues that come up in getting a good EKG. And, it's what they do now is they don't have that little machine they roll in anymore. They just set you up to a laptop computer that's got a program.
But that same dynamic of the difficulty of working with it is happening with the software.
And then you don't even have paper. And then you have to get it electronically transmitted from the laptop to the electronic medical records. And old people like me like to have paper to write on and scribble and measure and, see clearly and stuff like that. And so it's just a hassle.
Yeah.
But you can learn so many great things. So the first thing you learn is heart rate. So the way the EKG is, I'm going to talk about ideal EKG-ness. Okay. So it's printed on paper that has like little boxes, little squares, and those are timed to move through the machine at a very specific rate.
Okay.
I know, isn't that cool?
I had not
and
known
so
that.
then you can tell by looking at it, you can tell rates, and you can either count out the boxes, or if you're a super good cardiologist,
you just glance at it, right? You can just glance at the EKG.
Right, and there's bigger boxes and smaller boxes, and that makes it easy to. So really, really good EKG readers can just like tell by looking.
Right, because the whole frequency of the points on the
Right.
Oh wow, okay.
Yeah.
So I never realized that paper is technically it's like a graph paper.
Yeah.
And that it was moving.
It's a
through
graph paper with
way.
tiny little squares, a certain number of tiny little squares, and a certain number of bigger squares that are encased in a certain number of even bigger squares, so that you can look at it on minute levels and more generalized levels.
Is that still a thing to know? Are we discussing about lost technology now? Are we talking about that? Since if everything's going digital in the laptop and they don't have those big machines, is the paper and the way the paper works, is that still a thing that people are learning?
I think they can do electronic background graph paper.
Right.
Yeah.
Well, yeah, but
I
you
don't
would
think it matters.
I guess is the paper still a part of it?
In my life, yeah.
Okay, all right.
But not always. It depends
exactly.
where you're practicing. So a normal heart rate is usually 60 to 100 beats per minute. Okay. So if you're taking your pulse right now and your pulse is 59 beats, don't worry. Okay.
It's not a hard line. Okay.
No, it's depending on your physical condition and meds that you might be taking. So, but roughly 60 to 100 beats per minute. So a true rapid heart rate broadly is known as tachycardia, and there's lots of different kinds of tachycardia. So this is like the medical language language that we speak, this is a good example of that, is that we kind of Latinize it and use representative words. And so if you're worried about your heart rate and your doctor says you have tachycardia, and then you're thinking, well, I don't know, it just feels too fast. You guys are saying the same thing, okay? And too slow heart rate is broadly called bradycardia. So there's also different kinds of bradycardia and different kinds of tachycardia.
And when you say different kinds, there's different sorts of things, conditions that can lead to that.
Right.
Yeah, okay, gotcha.
Right. So that's the first thing that when we're taught to read EKGs, we have a systemic kind of manner that's done, and the first thing you look at is rate. So any provider get handed an EKG to interpret, the first thing they're going to go to is the rate. The next thing is rhythm, which is kind of cool. So heart rates can be regular or irregular. And then it breaks down from the kind of regular they are. It could be normal, what's called normal sinus, which is probably what you're in right now. I'm probably mostly in it.
And that's the dump?
Yeah.
Right?
Yeah. Lub dub.
Love dub. That's it. I forgot my medical terminology.
Yeah. So, but it can also be, out of the irregular beats, it can be irregular. Or irregularly irregular.
Okay, what's a regular irregular beat? Irregular.
So a regular irregularity is like a beautiful thing in children. And children, because usually their chest space is limited because they're tiny humans.
Yeah.
When their heart and their lungs have to coordinate when they breathe and when their heart beats.
Oh, what? Just so because of the space?
You can see an irregularity in the rhythm because the heart's going, go on, lungs, it's your turn. And
Oh,
lungs,
wow.
okay, thanks. Okay, now it's your turn.
Okay.
And it becomes a regular irregularity.
Gotcha.
Does that make sense? It's It's really cute. It's the cutest thing.
Yeah, no, just an irregular beat that you're supposed to, or you can expect at that
And as
specific
people
time.
get bigger and their chests get bigger, then their bony thorax gets bigger and the organs, have more of their space to find.
Right.
Then that goes away.
So so childhood heart murmurs they're typically like cardiologists, doctors, they go, oh, that's nothing. You'll grow out of that. Is that because of that sort of thing? You'll grow out of that. Is it just you'll literally grow out of it?
Partially is, and it might have something to do. You can't really pick up heart murmurs. That's a sound the heart makes. That's not on EKG usually. Right. Although you might get information about the
whatever's causing it.
Yeah, what's causing or how it's affecting the heart. But that kind of comes and goes, like our rivers. Think about our rivers. After a rain, you go down to the Smith and you're going to hear different sounds than you are, say, at the end of August. Okay. So as water rushes over pebbles or goes around boulders, so the same thing. And what you're listening to in a murmur is the sound that blood flow through your heart makes. And it's different depending on, does a kid have a fever? Did a kid just run in from the parking lot?
Gotcha. No.
Are they sleeping?
So what you're saying is a murmur isn't a function, or technically wouldn't be, or those kinds of murmurs, the murmurs that you might outgrow, or if it's maybe all murmurs. I don't know. You can clear me up.
Yeah, most murmurs are no big deals, what you're saying.
But it's more about listening to the flow of the blood as opposed to monitoring the electrical activity of the muscle of the heart. Okay,
and you can get, if somebody has a pathologic murmur, then you can get information. The first thing that's done, if let's say I'm doing a sports physical and I hear a murmur on a kid, then the first thing I do is an EKG and a chest X-ray. So you get more information to define what the problem might be.
Okay.
So the tracing also can give information about the position of the heart and the chest cavity.
Hold on. I think we dropped something here. We were talking about regular irregularities.
Oh, and irregularities.
Yes.
That might be something like atrial fibrillation.
Right.
Yeah.
How many different sorts of irregular? I guess it could be any number of. It's just an
they're
irregularity.
mostly bad.
Yeah. Okay.
Yeah,
but again,
that's things that people either have congenital heart disease as a kid, or you have acquired heart disease as an adult, and that's where you get into that.
Okay. So all right. So going back a couple of health matters, we were talking about heart health, talking about the sorts of irregularities that are common, that shouldn't worry you as a person when you're just walking down the street and your heart goes dum-dum. You're not dying. It's a muscle. It's doing that. Is that a regular irregularity or an irregular irregularity?
Well, if you have one every other beat, it's a regular irregularity.
Oh,
but
okay.
If you have them randomly,
it's okay. I got you. All right.
So you're talking about a PVC, which is called a premature ventricular contraction. So the way the heart's supposed to beat is the atrial chambers fired. So that's the lub, and then the dub is as the ventricular. So atrial is the preload, and ventricle is the pushing it through the body.
Right.
Okay. So every once in a while, for reasons known only to itself, you'll get a little excitable part in the electrical system, and it'll, suffer an attack of the old premature, as they say. So, thank you, Tom Robbins. So, it just kind of aberrantly fires, and it looks super scary on an EKG, but it is as close to no big deal in medicine as anything.
Yeah, just something comes and goes.
Yeah,
there you go. Okay.
It's a big snooze fest for us. But it scares people.
Right. Yeah. No, I've been frightened by those in the past.
Yeah. But we have a lot of them, and we probably don't know that we have a lot of them. And if you get too many, like let's say a regular irregularity would be to have like 2 PVCs and then like 3 normal beats, and then 2 PVCs and then 3 normal beats. And you might always have that, or you might have runs of it, depending on what you're doing. And so there's medicine and stuff to control that if it bothers somebody.
Okay.
So... but this tracing can also, this is cool. It gives you, this is the hardest part actually for me to understand, is that it gives information about the position of the heart in the chest cavity. That's why these leads are kind of placed all over, because these are different vantage points of the heart. And as certain types of heart pathology, let's say a part of the heart is enlarged or thickened, and it rests differently in the chest cavity than, say, Joe Normal, then this is a way to pick that up. And you can see, because the electrical activity takes longer to go through that part. And so they actually measure the axis, and there's more than one axis, but I mostly think of the head to toe axis, okay? So the vertical axis, but you can measure axes in a lot of different ways.
Yeah.
And this, I think, is where somebody interpreting an EKG puts a little bit of magic into it. And, that person's probably sitting in a dark room, with little calipers and magnifying lenses, and really the subtleties of how the tracing of the electrical energy moving through the heart is like, this is the art of medicine.
Yeah, I can see that.
Super amazing.
See, it seems like, I get from the 12 different leads, you're going to have a kind of parallax, an electrical parallax of the heart, and you're getting it, and it'll allow you to kind of see in 3 dimensions in that way as you work with light. Yeah. But each person has got to be different and individual and idiosyncratic too. That's got to be where the art and the interpretation comes in.
It's completely. And the cardiologists who get this, who are able to draw a 3-dimensional model in their brain from a 2-dimensional tracing.
Yeah, that's amazing.
Whoa, it's not me. Let me tell you, that's not me. So super right brain. These are the left brain doctors who have really, really good right brains. Them and radiologists and probably surgeons.
Wow, okay.
So because always in their mind, they have this rotating 3-dimensional model.
That's nuts. That's great.
It is cool. So the parts of the recorded cycle, there's different kinds of waves, and you might, hear people talking about them. And if I'm looking at, like somebody's tattoo or an art representation of the cycle, it is nowhere near as accurate, and it kind of, makes me twitch a little bit.
Really? Like your tattoo's
like really,
wrong?
That PR interval, that's like not even real. So the first one, and they're cool because they're redundant into infinity, as how many heartbeats that you have in a life, right? And they're remarkably, in the absence of disease, remarkably stable,
right,
in their presentation. And like, who thinks of this kind of stuff, like how they relate to actually how the heart is beating, and how that, and then by extrapolation, how that person's living. So the first one is the P wave, and that's the atrium firing. Okay. And it's kind of small because the atriums are just little preloaders, and they're not pumping body or blood through the body. They're just like stuff in the suitcase.
Right.
And trying to get it close. So
do we know why it's called a P wave?
I looked into that actually. So the EKGs were invented in the mid to late 1800s, and they were a lot of different people working on them, seeing them in a lot of different ways, and that's just how the guy described it. So not super exciting.
So with a kind of earthquake,
Yeah.
The
Right.
portion of the earthquake that it's the beginning of the first waves of an earthquake
It's a P wave.
is a P wave.
I'm not
And-
surprised. That might have been taken from that.
Yeah, I was
but it
just
was
wondering.
only randomly assigned.
Huh. Okay.
So and then there's the next segment is a QRS, and that's the ventricular firing and then repolarizing. No, the T waves repolarizing. That's a ventricular firing and a little bit of the atrium repolarizing.
Okay.
Does
So
that
the
make
atrium
sense?
going repolarizing. You mean going into the next beat?
Right.
Okay.
And then the T wave is the repolarization of the ventricles.
Just it's okay. Okay.
Yeah. So I think that's super cool. But we also look at the PR interval.
Okay,
So
okay.
the timing of all this, when these fire off, is super important. So the intervals, and then the ST segment, which is between the part of the S wave and the T wave, that's super important in heart attacks. So ST elevation means the heart's not getting the blood flow, and it's suffering from ischemia. That means lack of blood flow. So
Wow, okay.
that kind of defines a heart attack.
That makes perfect sense that you'd be able to see that just in the sine wave, depending on how
Right.
spread out that was, how high they were. Wow.
And
okay.
you measure it, and it's not only along the horizontal axis, but also the vertical axis, because it tells you how much tissue you have, and maybe it's a thickened wall, and there's a problem. So super intricate observations about all this. So the timing of each, the size and the shape tells us about how the heart's doing. For example, a T wave, which is the repolarization of the ventricles. So it's after the ventricles have fired, and the electrical activity is setting up for the next round, right?
Okay.
And so if somebody has too much potassium in their blood because they have a pathological process, or because they're on certain medications that do that, the T wave will look to peak, and it'll be more like a pyramid triangular shape as opposed to like a hill, like a rounded shape. So there's all kinds of like electrolyte abnormalities that can be picked up from an EKG just from measuring all these little things. There's, size, shape, anatomy, function. It's just kind of an incredibly intricate.
I just from what I know of like just sine waves and music, sound.
Yeah.
Just knowing the different shape of the wave indicates such a vastly different sound. And
I
it's
know.
just a wave, but you've got box waves, you've got your sharp
Right.
razor waves, you've got your
Right.
sine waves, and it's all an
Right.
entirely different noise.
And then it's how long a wave takes to be accomplished. Okay, so sometimes your QRS are narrow and it's happening really fast. That would be happening to somebody who has tachycardia because they have a rapid heartbeat, or sometimes they're like in a PVC or premature ventricular contraction. They're really wide and weird looking. So it's like the heart's like, shut up, you little excitable thing. We don't want to. Okay, just this once.
Once. The last thing you want to hear your heart say. All right, just this once.
Just this once. So anyway, EKGs have a great deal that we can learn from them. Some people are better at reading them than others. Oftentimes they're a hassle, so they're not done, and you might advocate for yourself as a patient, because an EKG is the beginning point of any concern that a patient or a provider has about how somebody's heart is working.
So what sorts of concerns should trigger that in
So-
you as a patient?
I have chest pain. I think my heart's beating too fast. I feel like I'm going to pass out. When I run, I feel like I have to stop because I'm having pain in a certain area. Anytime you're really asking your provider, I'm kind of worried that my heart might be the problem, then no provider should be super reassuring without an EKG.
Right. Are there any sorts of conditions, symptoms, things you might observe in the body that might not be on the surface a heart problem? Circulatory, coloration, things like that.
Oh, sure.
That might not suggest to the layperson that it's a heart issue, but would underlying be a heart problem.
Yeah. I think this might be answering you. Like if somebody's known to have lung problems, then heart and lungs, if the lungs are doing badly, the heart's doing badly. So And you could tell that because you have curved fingernails. Oftentimes it indicates lung disease. So I don't think anybody would look at curved fingernails and go anything more
Hearts. Yeah, exactly.
Okay.
I guess I'm just,
weird little things like that. How capillaries refill.
Right.
That's a heart.
Is that a heart issue or a circulation issue?
It could be both.
Okay, gotcha.
The heart is the circulation. It's
right,
the center
right,
of the circulation.
right. But as you were talking about, there's a difference between, say, understanding the electrical impulses governing a muscle, the muscle of the heart,
Right.
and the function of the heart, and there's a different set of things you need to know about and listen for,
Right.
and when you're talking about just circulation and
Yeah.
blood flow. So I was just wondering if there was something that might look like blood flow or tingling elsewhere in your body, but really is traced to the
Yeah,
electrical
totally.
problems of the heart.
Oftentimes women have, when they have heart attacks, they have atypical presentations.
Right,
and they
right.
might just have jaw pain.
Wow.
And then, so you imagine being an old lady and you're worried about jaw pain, and then somebody cracks the joke, well, maybe you're talking too much, and they let it sit there.
Oh,
That's
yeah.
not funny.
That person
needs an EKG
Wow.
at the beginning.
Well, yeah, but that's a different issue about just being
You're
an
right.
older an
Gender
older
in
person.
medicine, I get it.
No, I'm not even. No, I'm a man. I'm not talking about gender. I have the privilege of being a guy.
with denial.
Gender's not an issue for me. The just the fact getting older, where it's like oh, everything hurts. Oh, everything's a heart attack.
Right.
I'm entering that part of my life, and so
Right.
I'm having trouble discerning should I be concerned about this or not. Sometimes.
Yeah, I think sometimes, yeah.
I also talk too much, so there's.
Well,
And I'm sorry, I don't mean to undercut what you're saying about gender. That's very much a big thing. I was just had a
Right.
different question, and I was coming at it. And yeah, guys
Right,
don't
got
have
it,
to.
got it.
We don't
Yeah.
have to worry about that because we run the show.
yeah.
Yeah. That's
Oh, totally.
Yeah.
So here's a super cool thing called a Zia patch. I don't know if it's Zio or Zia. It's because it looks like it's printed Zio in the charts, but people pronounce it Zia, but ZIA. So this is a brand name. In my day, we used to call it a Holter monitor because that was the appropriate dead old white doctor guy.
Okay.
So, what it is,
See?
and it's something we have here, which is so cool. It's an EKG that usually lasts about 2 to 6 weeks.
Wow. Okay.
Depending on what you're looking for. And it would be a good thing to do on somebody who maybe has periods of dizziness, and you're which is a big deal because that can be a lot of things. Number one, that can be ignored easily. Number two, and that also affects the way people drive, which is kind of a big safety issue for the community
Right.
too. And so this is like having an EKG that records all of your heartbeats, say, for 6 weeks. And there's a component to it because it lasts over time where you can say, I'm having the symptom now, 3:30 Tuesday afternoon, it's happening now. And then somebody can correlate that with what they're seeing is happening with your EKG that's being read at that moment and be able to tell what's going on.
Wow.
Yeah, so super cool. Dr. Blundell reads them in the clinics. So they're put on by the nurse in the clinic. They're taken off really easy. It's kind of like a Post-it note with a little more adhesive.
Wow.
Okay, it makes you look kind of like you're partially Borg, you know. I bet the makeup person used a couple of them, and then so you wear it. You can even wear it in the shower and stuff, and then you have it taken off, and it's put in an envelope and somehow uploaded to a computer, and Dr. Blundell can sit there and count.
Wow.
To read all your heartbeats over 2 weeks, say, and then say, okay, this is what's happening then.
Yeah.
Or during that period of dizziness you're having, your heart is beating normally. So this is, maybe we should look at a neurologic cause or something like
That's,
that.
what a valuable tool.
And we have that in this community. Super cool. Thank you, Dr. Blundell. So, I personally did a Holter monitor back when I had my kid, my oldest child, which was 31. And I had a lot of PVCs because I was a working mom, right? So it kind of lives in my mind. I had, and in 24 hours, actually 23 hours, because I got mad at it and I took it off early. I had 6,010 PVCs.
Whoa.
Which is like, whoa.
Yeah.
And I was medicated to usually treat it with beta blockers. I was medicated during half of it and unmedicated during half of it, and there was no change. So and I went with denial on that one, and it all kind of happily resolved. But what I'm saying is the stuff that you can learn about your body is like super interesting to people to see what an electrical representation of their heartbeat looks like is. It's kind of a profound moment.
I'm intrigued by the artistry of the person reading just looking at these squiggles and going, oh, your problem's obvious. That's neat.
Right. So different kind of people go into different kinds of medicine, and that person has got to have a right brain that I don't have, because I'm like, yeah, sure.
Maybe this is something we've already touched on this topic, but for further, it seems like that sort of interpretation. That's what AI will end up picking up.
Well, yes, that's already happening. These EKGs are oftentimes read by the computer, and the computer writes a lot of really alarming things that when you fact check them,
they're not. Well,
it's like bring it back
so
the other guy.
They use the automation side as like a first pass, and then you have a human with actual abilities.
And people are. It's really hard when you're reading an EKG not to go there first.
Yeah, right.
Yeah.
Okay, yeah.
So for the provider, there's a struggle to do it the correct way and read it, with the human mind involved. But there's a lot of stuff I disagree with in the machine. I think the machine is a little too persnickety, and it can be affected by something like some guy's hairy chest.
Oh, right. Yeah, okay.
Can change the reading and stuff like that. So I don't think AI is always going to be the answer for that. Yeah. These right brain guys sitting in the dark room with the magnifying glass, they're not replaceable. They're really not.
I see them as like medical monks in like a cloister somewhere.
Right. The pathologists, radiologists, and EKG
and the Holy
specialists. Yeah. They're all a little weird. So.
We filled up that half hour. We're out of time, actually. That's amazing. That was really informative. Thank you for that.
Yeah, interesting. So ask your doctor why, if an EKG might not help with diagnoses. Ask.
And ask him why it's K.
Yeah.
Yeah, that's what I'd like to know. Yeah. Any idea about next week?
Hallucinogenic mushrooms during the dying process.
Oh, whoa.
I'm thinking of trying to entice Michael Fratkin back on because he's doing a citizen science project where he wants to look at hallucinating at the moment of death. I don't really get it. So you'll have to explain it a little bit more.
I have questions
But I'm sure
about
he's
that.
a brilliant man.
Yeah,
I'm sure that there's something that we could learn in that.
Right on. All right. Well, look forward to that. Whatever happens next week, I'm sure.
He's going down the Colorado River right now, so he's busy, right?
Oh, well, I won't try to call him then.
Yeah.
Hey, what you doing? All right. Well, thank you very much for this week's Health Matters, and we'll see you next week, Lynn.
Yeah.